When should you appeal a Medicare denial? Imagine getting a bill for a service you thought Medicare would cover, only to find out it was denied. What do you do next? Knowing when to appeal can make a big difference in getting the coverage you deserve. You should appeal a Medicare denial whenever you disagree with their decision to refuse coverage or payment for a service, item, or prescription drug. This includes cases where Medicare or your Medicare Advantage plan refuses to pay for care you already received or denies approval for care you haven't yet received. The first step is to check the denial notice carefully. You must have a written notice from Medicare or your Medicare Advantage plan explaining why your claim was denied. Without this official notice, you cannot start the appeal process. Next, pay close attention to the time limits. For Original Medicare, which includes Parts A and B, you generally have 120 days from the date on the denial notice or Medicare summary notice to file an appeal. For Medicare Advantage or Part D plans, the deadline is usually 60 days. Filing late might still be possible if you can show a valid reason, like illness or disability, but acting quickly is best. You should appeal if the denial is for services you have already received, known as post-service denial. If Medicare denies coverage before you get care, called pre-service denial, you should also appeal promptly. If waiting could seriously harm your health, you can request an expedited appeal to speed up the process. Gather all relevant documents to support your appeal. This includes medical records, bills, and a letter from your doctor explaining why the service or item is medically necessary. Strong evidence can help your case. Medicare has a multi-level appeals process. The first level is redetermination by the Medicare contractor. If you disagree, you can request reconsideration by a qualified independent contractor or an independent review entity for Medicare Advantage plans. If still unresolved, you can request a hearing before an administrative law judge. Further levels include review by the Medicare Appeals Council and, if needed, a judicial review in federal district court. Always read your denial notice carefully to understand why your claim was denied and what steps to take next. Contact your healthcare provider for help preparing your appeal. Keep copies of all documents you send and receive. If your case is complex or involves large amounts, consider seeking legal advice. Appealing a Medicare denial is the right move whenever you believe Medicare has made an incorrect decision about your coverage or payment. Acting quickly and following the instructions in your denial notice ensures your appeal will be considered within the required deadlines.